This is WPSL Port St. Lucie, the talk of the Treasure Coast.
It's 11:07 at WPSL 1590, the talk of the Treasure Coast, and you are on Money Info with the great Wize Oz himself, Mr. Charles Moskowitz. Hey, welcome.
How you doing, Greg?
Happy New Year.
Yeah.
Yeah.
Hold on 1 second, Greg. I have Jacob on the other line.
Okay.
Hello.
Yeah, so Charles is doing business
Say
in
that again?
the basement office there.
No.
Right off of Cape Cod.
Just hit the
buried in snow, I'm sure.
the
So it's
link.
quite the week for
Join meeting.
Mr. Charles to
All right,
be
thanks.
on the air. Of course, we all
Okay,
know what.
Greg, Jacob will be on in a minute or two.
Okay.
But I just wanted to say, this is not about patting myself on the back, although it is a little, but for the last, 60 days, I've been talking about the market making new highs and the fact that the setup was kind of interesting and that it was going to be very negative for the first quarter. I'm not going to tell you that I expected to see down 10% in the first couple of days of the year, but I will say that the reason that I was so negative on the markets, even though they were making new highs, was that there's kind of a shadow under market here that just to use the statistic, we were actually 40% of NASDAQ stocks were down 50% last year. So, if you didn't own those big 10, the Microsoft, Apple, Google, etc., then you were hurt, and you were hurt badly. And, as soon as the big names started to come in, people just, nobody wanted to be the last one out the door. Okay, so
Can you guys hear me?
Say again?
Can you hear me?
Oh, yeah. Okay, so James is on. Says James iPhone.
No, it's Jacob. So the reason it says James is I'm using my brother's phone. It's a little bit better equipped.
Got it. Okay, so Jacob Dimartino, he is the CEO of a company called RAADR. This is, from my perspective, one of the most exciting kind of deals because it hits a very, very big touchstone issue for anyone who's a parent or a grandparent, because it deals with cyberbullying and all of the other issues surrounding social media. And, now with not only law enforcement using social media, even colleges and employers are beginning to look at every applicant's social media. And Jacob's deal is, number one, AI based, so machine learning. But more importantly, I'll just let him tell you how they differentiate themselves from all of the others that are already out there. There are a couple of pretty major differentiations that I think RAADR really hits on all of them.
You know, what's really interesting, guys, is you know, our basketball team at Indian River State College is doing very well, number 3 in the country now. And the one question that always comes up with all the Division I coaches that we meet along our trail is they're not basketball questions. The first question that comes up is your social media.
Yeah, and it's a huge issue.
And character. I mean, those are the two main questions that come up.
Yeah. Okay, Jacob, hit it.
Well, I really appreciate you guys having me on. I'm excited to, get this news out. We have a brand new app that's launching, our newest version that launches on January 30th. I'm very, very excited about. As you touched on, our kids are faced with just unprecedented online dangers nowadays, from cyberbullying to campus violence to suicide to mental health. It all plays in, and this technology, like you said, Charles, is artificial intelligence. So it allows parents to get a snapshot of what's going on with their child, without really infringing on their kid and making their kid feel like they're spying or monitoring them. This is all about prevention. It's all about prevention. So what this product does is it scans the internet every 6 to 12 hours looking for inappropriate images, inappropriate content, risky behavior, social media etiquette, all those things play into it. And it allows to really a parent to get a snapshot of what's going on through our dashboard, and gives really the power back to the parent, which we're really excited to do.
And it also doesn't infringe on the child's device, correct?
Correct. Yeah. All of our competitors, as you mentioned, Charles, they are out there. They all require the child to either get a phone or a piece of equipment that already has monitoring apps installed on them, or requires the child to download a monitoring app so they know that they're being monitored. So, and we all know how kids are nowadays. They're very savvy. They're very slick. They can slip through things like that. So we're the only company that's using artificial intelligence. Oh yeah, and by the way, there's no cost for our app. It's absolutely free. The average cost with our competitors is anywhere from $29 on up to $49 a month. And I feel that this is a piece of software that no parent should have to pay for to have peace of mind online with their kid.
Well, I'm a big stat guy, and one of the stats that comes screaming out at me is that 9 to 12-year-olds, 21% of them are being cyberbullied. Really?
Yeah, it's sad, and then it plays into suicide too, right? So you've got your statistics of kids that have been bullied, and then for let's just take 16-year-old girls. The number 1, 2 cause of death is suicide. That's absolutely ridiculous. It's ridiculous, and kids are killing themselves at a rate now that is a true pandemic. If we want to talk about things that are pandemic, this is something that we should all really focus on, is being vigilant about protecting our kids and monitoring our kids. Because from the body shaming to the overhyped sexualization of young girls now we live in it with society where young girls in junior high are already competing with each other, even in middle school, on their social media pages, how they look, the representation of themselves. It all plays into where this world is going online. And it's a very, very dangerous place. The statistics speak for themselves. Mental health plays a very huge role in it as well. And the addiction to phones and the addiction to social media is only going to grow. It's only going to grow. There's a great actress, her name's Regina King, been in many great movies. She just recently lost her son 3 days ago. Her son committed suicide, and her son was online several weeks before this, leading up to his suicide, crying out for help, making posts that were all relevant to saying, hey, look, I need help. And that's what I want to prevent, or those type of scenarios and situations from happening.
Yeah, we had a pretty major case up here locally of a girl who was prosecuted for cyberbullying a boyfriend of hers, and she was found guilty. I mean, there's an appeal going on, but it was pretty big national news, and it was right here in our backyard.
Yep. There are other cases, you know, parents are being held accountable too, you know, in different cases in Florida that I've heard, and in different states where the bullies who are actively bullying somebody who then commits suicide, you know, those parents are held liable for negligence if they are not monitoring what their kid is doing, and they're, you know, basically putting other kids into a situation where they kill themselves, you know, and it happens all the time. Or they bully the kids so much that the child now comes in to harm others on campus, and we see it all the time, shootings that could be prevented and stopped. A lot of the times the shooters, the kids that are doing the shooting and killing have been severely bullied, have been picked on, and have been put into that position. It's not always like that, but that's, you know, the case a lot of the times is these kids are victims of bullying, and they come back. And we see it, and it's sad. It's very sad, and a lot of these things could be prevented.
Yeah. Wow. You know, the stats just kind of, you know, what happened to the days of like when Charles and I were coming up. You know, you just go out and play ball, and you're outside for until the sun comes down. And
if you were thirsty, Greg, where'd you drink from?
Oh, the water fountain outside.
The hose.
Right.
Or the hose. That's so true.
Times have changed. Times have changed.
And
you're right.
And, you know, and the only thing that you had to be aware of was when the street lights came on, you had to head home.
Yeah. No, that is so true. And your mom didn't want you home.
That's right.
Before that, you know. But, you know, I can't believe, again, more stats about 9 out of 10 students are into gaming and stuff and social media. You know, traveling with these kids as I do, and these are, you know, 18, 19-year-old kids that are buried in their phones. And our head coach, the one thing he does, when we get to a site where we have to play, he collects all phones, puts them in a box, they stay on the bus.
Yeah.
There is no way once they get in the arena that they have access to their phones. And I think that is a great idea. I've seen other coaches that let the kids bring phones on the bench. You know, it's like, you got to be kidding me. But yeah, you're right. It's like these things have been very addictive to kids.
Well, you know, last not this past Thanksgiving, but the one before, we took a house out in Martha's Vineyard, and the internet, we got stuck in a storm, and the internet went down. And you would have thought that the two girls, not the grandson, but the two, because he was a little younger, the two girls practically lost their minds.
Yeah.
Because they couldn't get online.
Oh, that's a fate worse than death.
Yeah, be stuck with your parents and no internet.
Oh.
Yeah. That's a bad scenario for most teen girls, most tweens. But you know, kids live on their phones. These new social media platforms pop up overnight. You know, there are a lot of online dangers that are right down the future for everybody too. The new metaverse is going to be loaded with online dangers. The blockchain, you know, we've already had incidences on the blockchain where child pornography is being put on the blockchain. You know, I mean, those images are hard to remove too, to remove anything from blockchain. So our technology crawls all these platforms and constantly is updating our system and our users so they know what is actually happening. You know, my kid may not be being bullied or involved in any dangerous activity, but what about the social media etiquette? What are you wearing? What are you posting on your friends' private pages that your parents can't see? Our technology can pick that up. And, you know, that's the thing. A lot of these kids out here, they don't think before they post things and get involved in these viral TikTok videos that are very, very, very adult oriented. And I've even experienced it myself with my own child, beta testing it. She's a great kid, but I had to address some things just about her social media etiquette, and potentially risky behavior, you know, just in pictures. And that can lead somewhere.
And, you know, you mentioned the metaverse thing. One of the other influences that clearly is, I don't want to say injuring, I'm not sure that's the right word, but a lot of the gaming in particular has an awful lot of death and murder in it that have no consequence.
Right.
I mean, you know, you do Grand Theft Auto or, you know, one of the others, and you're completely removed from it. You know, all a kid has to do is hit restart. So literally there is no consequence. And I think that's you know, that's been an issue since gaming became so well developed.
Right.
Where the phone is better than, you know, your desktop was 2 years ago. And, you know, it tends to grow pretty much exponentially. And it really sends kids, especially teens. And, you know, I know that we talk about the girls a lot, but, you know, it also deals with, you know, preteen and teen boys who just don't see that there's any consequence for their actions.
Right. All the time. You know, the Call of Duty is another game that you could look at that is just like what you're explaining, you know, a lot of death, a lot of killing. You can even look at statistics like, you know, now the average age that a kid is exposed to pornography is 7 years old. You have, you know, celebrity like Billie Eilish, who's a very well-known Grammy Award-winning singer, saying pornography ruined her childhood. You know, you have all these things now, like you just mentioned, that are just gearing kids towards a bad future, right? So, you know, I tell parents all the time, you've got to be vigilant about what your kids are engaged in, what they're watching, what they're following, the kind of games they're playing, because as you just mentioned, they get to a point where they don't care, where they think death is just normal, where they think, you know, that these things that they should not be seen and engaged in are normal. And that's, you know, unfortunately the society that we're in right now, you know. So this tool, this piece of technology that we've created really puts the power back in a parent's hands. It gives them the power now, instead of, you know, letting a child who's running around with a $500 to $1,500 device, which I call a computer, which is a phone now. They don't know how to use them. They don't know how to truly, you know, respect the fact that what they're putting out there, other people can see. So, you know,
you know, it's a funny statistic, but this goes back a couple of years. So not even today's smartphones, but even a flip phone 5 years ago had more computing power than it took to put men on the moon. And so, you know, that's
very true.
That's an awful lot of power. Jacob, why don't you tell them a little bit about how it's actually done, what you have to do when you get the, you know, when you get the software, and what the parent has to do and how it reflects on the kid.
Sure. It's really simple. You know, it'll be available in the iOS store and the Google Play Store. So a parent would download it just like they download any other app. They'll agree to the terms of service and the privacy policy when they sign up. They'll authenticate themselves, obviously, as the legal guardian and or parent of the child. As soon as they've downloaded it and done those things, then they immediately go to a screen that has them add their child to be monitored. So really, they just need to know some very basic information. They need to know their first and last name. They need to know what email address they use, and they need to have an image of the child, a good, clear image that they can upload. Based off of that, there's a list of a bunch of different additional requirements. They aren't required, but they're additional if they want to add them, as in their handles, whatever their handle is on Twitter, Snapchat, Facebook, Instagram, any of the, maybe if they go by an alias, their sexual orientation, what some of their friends' names may be, all that is added into the system as well. Then they'll come to a screen where it allows them to pick from a topic of keywords. We have about 20 different topics. The topics are all tied to thousands of keywords in our database. So for example, cyberbullying is a topic, acronyms, we have ISIS recruiting, we have all different types of topics that relate to thousands of different keywords. So if a parent was to select on all 20 topics, their child would be monitored for thousands of keywords that relate to those topics with their image as well. So once all that is created, which takes about 3 to 5 minutes, then the system gets to work. And within the first, 12 hours, it'll start feeding information through the dashboard, and then it'll just be continual. So the parent can log into the app, go to the dashboard, and, get a snapshot of what's going on. Things will be broke down into more of serious categories. But for right now, everything's going to come through either in images, videos, or content that may relate to what they're monitoring the child over.
Just amazing. And this is rolling out this weekend.
Yeah, the 30th we set to launch to the public. There may be a couple day lag time because iOS and Google, they do take sometimes a day or two to approve the submission to be published. But our aim date is this Sunday, the 30th. And I'm looking excited. We're going to have a launch party here in Scottsdale, Arizona, where the company's corporate headquarters are on February 5th, which is a Saturday. We're going to be really, really connecting with a lot of influential people to create relationships for distribution channels for the app. And that's what I'm excited about doing through the rest of this year.
And just so that we clarify it, since you're not charging the parents for it, how does it get paid for?
Well, the company is going to go the advertiser route, and we're going to create relationships with which we've already started on B2B, business-to-business relationships, where we bring in advertisers who will pay for space within the app. Once we start accumulating and rising with our users, that's a model that is very, very lucrative and bodes very well for the company. Based off of the space that we're in and the type of advertisers that we're aiming towards. It's going to be a beautiful relationship.
And I would also think that police agencies would really favor something like this.
Could you repeat that? I'm sorry, I didn't hear it.
I would think that police agencies would really support something like this as well.
Yeah, that's great. You're exactly right. They do. We've actually, when we first launched the company, had relationships with the Buckeye Police Department, and they're very, very upfront about monitoring for child protection, safety, cyberbullying. So we've already got a relationship with them here locally, but we want to expand that nationwide. And you're exactly right. Our LEOs, our law enforcement, are big backers of the RAADR products. Not just our parental monitoring app, but we also have a child reporting app, which is for kids, which is free as well. And that'll be out later this summer. We've made a bunch of revisions to that and are working on it currently. But that is another app, again, for kids to report campus violence, suicide, report it to law enforcement, administrators, whoever they feel comfortable. So you're 110% right. LEOs are big backers of RAADR.
Wow, I think you're on to something.
And you're differentiated on several levels.
Yeah. First of all, the way we go about finding the data. Second, we're the only app that I know of in the space that is free. You can monitor up to 6 kids at one time. We're using artificial intelligence, which is the future. Machine learning is something that is growing, and it's an incredible technology. using facial recognition with images. This is all the future, and we are constantly changing with the future. Like I said, the metaverse is something that is going to be a new world that social media, people are going to live in. Basically, you can buy virtual real estate. Celebrities are already doing that, with NFTs being a big part of the ecosystem within it as well. There are so many dangers involved in all of those things for children, and we want to stand on the forefront of being able to monitor all that and not making our kids feel like they're truly being monitored, right? Because we want to trust our kids, but we also want to be vigilant about monitoring them and making sure everything's okay.
Hey, Jacob, do you have any real competition in this space?
Yeah, there's competitors out there. Web Watchers one, Bark is a competitor. These companies are great companies. I don't even call them competitors. I call them like-minded social media advocates. We all want to protect our kids and educate our parents, but the institutional difference, first of all, is we are free. Bark charges anywhere from 20 to 30. Web Watchers, around the same cost, maybe a little bit cheaper. But again, they're all requiring the child to download the monitoring device onto their phone, the app. So in essence, the technology is really you're monitoring a phone with an app on that phone. So ours is completely different. We're monitoring through artificial intelligence. So, these competitors are not doing that. They're not, none that I know of. And I'm on top of it in the space. So I feel like we are ahead of them, even though in all actuality, they've been in business longer than us. I feel like we're changing faster with the times. And our app is so unique in the sense it's very user friendly. I beta tested it for months and months to make sure practically if you don't have any smartphone savviness at all, you could download this app, add your child, and have the system start working for you.
Yeah, somebody was mentioning to me the other day, I was discussing this, I think, with one of my subscribers, or I might have been in my Discord room, but they sent me a bunch of pictures of their child. And what's amazing about facial recognition is, along with AI, it learns. And there were pictures of this child with only half of her face showing. One where, she was in with a group of people standing in the back and you could only see, a sliver of her face. But all of these things popped up on facial recognition. I mean, the level of usability on that type and joined with AI is really phenomenal.
Okay,
Yeah,
question.
Go ahead.
What do the kids have to say in all of this? What has been their reaction to this program?
Well, so far, we'll just use my child as an example. There was a lot of value propositions that came out of beta testing her. She was kind of the guinea pig. She's 15 years old, great kid, a lot of friends. Let me give an example. She doesn't post anything on her Instagram. She's got one picture, so when I started to do my beta tests on her, all the things I found were all on her friends' pages, which are private. And again, there were things that I had to address. So let me tell you what happened from my scenario, which I think is going to happen to millions of other dads out there. I confronted my daughter about these. Obviously she said, well, how did you pull this up, this and that. She understands what dad does now. But now the value proposition is my daughter, she now thinks twice before getting in any photo with her friends that could be considered inappropriate. She also does not get involved in any more TikTok videos that are of adult content or inappropriate. And I think that alone, did she like it? No. But did she feel like she was being spied on? Did she say that was intrusive? Did she feel like her rights were taken? No. And anybody that comes and says that, I'm sorry, but we all know that this is about prevention. So, kids may not like it. My daughter was obviously upset that I found some of this information, but at the same token, I addressed it. We had a great conversation, and in my eyes, the app worked. And now that I continue to monitor it as our beta test, we're not finding anything. And that's the best thing that can happen to a parent using the app, is they're not finding a lot of this stuff because it's not happening, because their kid's not involved. So, you know, to answer your question long-winded, hey, they may not like it, but tough. It's going to happen, and it's, you know, part of our society now.
You know, if the fact of the matter is, it's already happening from the negative side. So
Right.
having something to combat it is a big step.
Yep. 100%. Parents have to be vigilant. They have to be vigilant.
So I see that Ben is here. So we're going to close this down with Jacob, but he will be back next week. He can give us a little bit of an update on the launch, and of course we can go into some of the other areas. The symbol on the stock is RDAR, and take a look at it. I think you'll be pleased, and thanks for coming on, Jacob.
Thank you, guys.
Hey,
Appreciate the time.
Jacob, do you guys have a website yet?
Yep, we do. It's www.RAADR.com.
All right. Well, that sounds great. And okay, this sounds good. We'll be talking with you next week. What a great idea. Wow.
Yeah.
Yeah, looking forward to it. You guys have a great rest of your day.
Yeah, the differentiation is, I think, head and shoulders above just the idea.
Yep.
Great. I see we have Ben here. Hey, Ben.
Hey, good morning.
How are you?
I'm doing very well, thank you.
Okay, Ben, you're the CEO of Filament?
I am, yes, CEO and co-founder, in fact.
Oh, great. Okay, you know, this is an area that we've discussed before, Greg, with Kelsey, I think, did a show with us. And this is an area that interests me greatly because alternative medicine has really gained a great deal of strength over the past couple of years. And the psilocybin is a pretty major part of that and still evolving. So, Ben, why don't you give us a little bit of information about the company, about Filament, and bring us up to date where you are and where you're going.
Sure, yeah, pleasure to be on. Filament Health is a psychedelic company, obviously, as you alluded to. But what sets us apart from the other companies is that we're focused exclusively on the natural side. And what does that mean? Well, we actually make all of our drug candidates, all of our products get extracted from natural sources because we believe there are a number of different advantages. Up till now, all psychedelics research has been done using synthetically manufactured psychedelic compounds, meaning compounds like psilocybin that have been recreated artificially in a lab. And, you know, there's nothing really wrong with that. And in fact, we're seeing that these synthetically manufactured compounds are good, right? And they work and they're relatively safe. But we think that they leave something to be desired in a couple of different ways. First and foremost, it's important to remember that a plant is much more than a synthetic compound, right? You know, a natural source will contain many compounds, and when you extract it, you replicate all of those compounds as if they were found in nature. You know, in the case of cannabis, you could think like, well, a cannabis extract is a lot different than synthetic THC. It contains CBD, et cetera, et cetera, et cetera. Same thing is true for magic mushrooms and other psychedelic species. When you extract from the magic mushroom, you get not just psilocybin, but you get psilocin, baeocystin, norbaeocystin. The list of compounds goes on. And we believe that over time, we will be able to prove that this complement, or what they call the entourage of different compounds, can be more therapeutically effective than the single isolated synthesized pure compound. And Also, one of the reasons that we focused on natural extraction manufacturing is because we have a very deep, myself and some former colleagues that started Filament together, we spent our whole careers manufacturing these kinds of botanical extracts. And we didn't really see anybody else in the psychedelics industry well positioned to take advantage of this opportunity. Because of prohibition and because botanical extraction just really aren't well understood fields, this meant that a lot of really valuable IP related to the natural extraction and manufacturing was available for us to claim. So we've gone and filed patents on our manufacturing technologies and have already been issued patents for those applications, leading to us producing botanical drug candidates that are quite protected in nature, unlike a lot of the other drug candidates that you see in the psychedelic industry. The third advantage of the natural is simply that, well, people prefer natural products, right? People don't drink synthetic caffeine in the morning. They don't wish for more synthetic food dye as opposed to natural food colorings. They don't wish for more synthetic cannabinoids. And we think the same thing will be true for psychedelics as well. And so we're happy to provide for the first time naturally sourced psychedelic pharmaceutical grade candidates.
So what is the biggest difference between Filament Health and your competitors, if you have any?
Definitely the biggest difference between us and the other psychedelic companies is our focus on natural, right? By far and away, the vast majority of attention and resources go to synthetically manufactured drug candidates. It seems strange to say, but this is one of the few industries where the natural is still the underdog, right? You go to any other industry and the natural is king and it's the synthetic that's the underdog. We obviously believe that after we progress that natural will be the king in the psychedelics as well. So we think obviously that's why it's a very good opportunity to come in and invest in our company.
And is there a difference vis-a-vis like FDA for something that you manufacture versus something that you extract?
There is, and that's a very good question. And in fact, the FDA has a very specific development program. It's called the Botanical Drug Designation, and it specifically accounts for products such as ours. A botanical drug differs from a normal drug, I guess you could say. It's important to remember that in a lot of jurisdictions around the world, natural products are considered to be pharmaceuticals. Natural is medicine, right? It's just here in North America where we have this dichotomy where the pharmaceutical industry has sort of been taken over by synthetic chemists. That's not true in Asia. It's not true in Europe. But a botanical drug is by definition something that was sourced or extracted from nature and contains a complex mixture of multiple active ingredients. And that fits our product perfectly, right? When we extract from magic mushrooms, we extract not just the psilocybin, we extract the psilocin, the base, all these other compounds, and we actually preserve them in the exact same ratio as if you were to consume a magic mushroom. The thing that we do is we make a highly standardized dose. So you know exactly how much psilocybin and these other compounds that you will get. Unlike if you were to consume a magic mushroom. Magic mushrooms, the problem with them, we think they're great, but the problem they have is that they're quite variable, right? Different mushrooms can have a widely ranging different amount of these active compounds. And again, while that may not be such a big problem for recreational use, for any kind of therapeutic use, the whole point is to have a highly standardized, precise dose. And that's really what we're here to provide.
That's great.
Well, now, is this like you mentioned magic mushroom? Is this like a mushroom or is it a pill or what is it?
It's a pill. So you can think of, if you go to Whole Foods and you go to the dietary supplement aisle, you'll see green tea extract or cranberry extract, and it comes in a little capsule. Our products, we actually have 3 clinical trial candidates right now. The big difference with those things that you see at Whole Foods is that ours are pharmaceuticals, but they look kind of like those capsules that you would see in the Whole Foods aisle. We have 3 botanical drug clinical trial candidates that are currently in phase 1 trials at University of California, San Francisco. We have an oral capsule standardized in psilocybin. We also have an oral capsule standardized in psilocin, which is another compound from the magic mushroom that I'll touch on, as well as a sublingual tablet of this compound, psilocin. This trial at the University of California, San Francisco, was actually the first time that the FDA authorized the use of a naturally sourced psychedelic candidate in a clinical trial. And it's the first time they authorized the use of psilocin directly. And why is that significant? Well, contrary to popular belief, psilocybin's not actually active in the human body. It needs to convert into a related compound called psilocin. It's actually psilocin, which is the active compound. But because psilocin is unstable, especially when you manufacture it synthetically, up till now, all research has been done on synthetic psilocybin. Because we approach things a little bit differently, and we look to nature for our sources, and because psilocin is actually present in the magic mushroom, we identified it as a very promising drug candidate early on, and we developed a lot of really interesting technology to both extract it from the magic mushroom as well as stabilize it and standardize it. We expect that administering psilocin directly will have a number of benefits, such as faster onset time, lower side effects, and also more consistent dosing. We think that psilocin will be the better drug candidate compared to psilocybin over the long term. And like I said, we're the only company that has both manufactured it and gotten it into human clinical trials.
And what is it that you're trying to treat in these?
So we're focused on depression as our primary indication for our magic mushroom products. We should mention that the mental health crisis is one of the major challenges facing our society at this time. Right, deaths of despair are climbing and close to the leading causes of death. What do I say? 1 in 5 North Americans will have a mental health episode in any given year, and by the age of 40% of North Americans will similarly undergo some kind of mental health crisis. Our drugs are designed to provide relief for these types of indications, but a lot more clinical research needs to be done before we can market them for these indications. And for any psychedelics company, it's important to remember that no psychedelic therapy is an approved drug anywhere, and lots more research still needs to be done. We obviously think that our natural products can end up being more effective and more accepted by the consumer, but there's still a relatively long road ahead for anybody.
And I think the COVID-19 crisis over the last couple of years has just magnified all those problems.
I agree 100%. Isolation, people, we know that humans don't do well when they're told that they can't see their friends and families and loved ones. Another thing, though, that I like to think about is that here in Vancouver, British Columbia, and in many places around North America, we have an opioid overdose epidemic, right? We have almost as many people dying in certain situations from overdoses and tainted drugs as they are from COVID. And for COVID, we essentially shut down society. And for the opioid overdose, we have a very good potential tool at our disposal in the form of these psychedelics, and yet they remain, class 1 prohibited substances. It really doesn't make a lot of sense, right? That we would go bend over backwards for COVID and an emergency that's almost of similar magnitude. We can't even kind of increase access to controlled substances, which are, frankly, natural substances which humans have been using for thousands of years.
Well, I know that the state of Washington locked down pretty tightly. What about your province up there in BC?
We've been in and out of lockdown. I think we probably escaped the most brutal brunt that other jurisdictions got to, but we're very fortunate to have a very professional, accomplished public health system, and I think a very obedient population of Canadians that we're happy to obey all the different guidelines and things. And because of that, I think that BC it would be unfair to say unscathed, but BC has fared relatively well compared to many other places around the world.
Well, I'll tell
And
you,
how does the company support itself now before it really has a product to sell?
Yeah, that's a great question. We've raised up till now about $12 million over the last year in the process of going public and prior to that as a private company. So we're relatively well capitalized for our near-term clinical objectives. But one of the interesting things that we're able to do, because we have IP protected drug candidates, there are several other psychedelics companies that actually have entered into licensing agreements with us and actually pay us to use our drug products in their clinical trials.
Yeah, that's kind of what I wanted to get at. I know that a lot of companies in your position tend to license and farm out, let's just call it samples for use of other companies.
It's not like free samples giving out on the street, although
Right.
it would be fun, but it's like you're exactly right. Usually biotech is very high risk, high reward, right? It's very binary, kind of almost a gamble, right? In our case, it's not quite so risky for a number of reasons. One, we're studying compounds which already have a pretty good demonstrated history of safety and efficacy, right? So contrary to coming up with a completely new chemical that's never been administered in humans before, we're using things where we can be reasonably confident that they will work. Also, in the meantime, we can actually license out our drug candidates to third parties to have in their clinical trials. This is a great way for us to spread the risk and the cost of drug development, right? So you can imagine if there's 10 or 15 different companies that are paying us to have our drugs in their trials, and eventually 3 or 4 of them get to have approved drugs, we get revenue before those drugs get approved now, essentially, which is great. But then once the drugs get approved, we'll be able to have a royalty from that. So it's a, like I said, really neat way of kind of spreading out the risk and the cost, but still participating really nicely in the upside.
Yeah, clinical trials tend to get expensive.
They certainly do, especially in the later stages of drug development. You're talking 30 to 50 million bucks for a late stage clinical development, or more, depending on what the indication and what kinds of trials the FDA makes you do.
Yeah, and so the stock is listed both TSX, I believe.
We're on the NEO exchange in Canada. The symbol is FH, and we're on the OTCQB FLHLF.
And a website for people to look at?
The website is filament.health.
And I was actually pretty impressed that the company had the foresight to take 10% of the founder shares and start that foundation. That's, very impressive as an early step for a company your size and your age to actually be forward thinking enough to do.
Yeah, we believe that there's a lot of awareness about psychedelics, about the potential of psychedelics, about the history of psychedelics. There's a lot of awareness. There's a big awareness gap that needs to be filled amongst the general public. Sometimes in the psychedelics industry, we kind of act and talk as if everyone accepts these drugs and everyone knows about them, and we almost act as if they're approved drugs, but that's certainly not the case. And so we started the foundation, the Filament Foundation, in order to fund initiatives that bring additional awareness to the field of psychedelics, and particularly to natural psychedelics, as well as to potentially fund clinical research in areas that may not get a lot of attention, right? So those are the reasons why we decided to pledge 10% of the founder shares into the foundation.
Now, where do you get?
I'm 72, and the first thing that comes to my mind when I hear psychedelics is Timothy Leary.
Of course.
Yeah, me too. You should be headquartered in San Francisco. Oh, never mind. That's and you don't have flowers in your hair. So I mean, what the heck.
I tell my team, because of the nature of the subject matter that we're working on, no one's ever going to think that we're too square, right? So they have to wear collared shirts, they have to have a clean shaven haircut, all that kind of thing. Because if they go around with flowers in their hair, people won't take them seriously, because the subject matter is already far enough out there. So we need to be, we want to show that we're a serious pharmaceutical company that happens to be focused on natural psychedelics, rather than natural psychedelic enthusiasts that have a side project as a pharmaceutical company.
Yeah, well, looking at your website and listening to you, I certainly think no one would begin to make that mistake.
Are you calling me square?
You're hip to be square. Oh, what about, where do you get your natural products from?
That's a really good question. In the case of the magic mushrooms, we actually grow them in-house. We have a 3,500 square foot facility here in Vancouver, British Columbia. This is where we grow, analyze, extract, and produce all of our magic mushroom drug products. These little mushrooms are fantastic little producers of psilocybin, right? They grow in the dark. They control their own climate and humidity and everything like that. They're really amazing. For some other, these plant species, the ayahuasca herbs, ibogaine, these need to be imported from jurisdictions all around the world. And so we have an active sourcing program which tries to find sustainably harvested and so good agricultural collection practices compliant sources of raw material. That when you're making a natural drug, obviously the source of the natural substance is a very, very important consideration. But luckily, it's also something that we have a lot of experience with from previous companies.
You're like the Whole Foods version of acquisition of these, where when I walk into Whole Foods, they have 97 things that they can trace back for the hamburger meat that I buy.
It's like that, but even more, right? Every little component of our drugs needs to be traced right back to the source. That's one of the key components of what's called GMP, is traceability. In case there was a problem somewhere along, just like with Whole Foods, if there was a problem in their vegetarian meat supply somewhere, they would want to know about it, just like us.
Yeah. Well, this is really great. And why don't you give everybody the OTC symbol, because this is primarily for people here in the US. And I really hope that we can have you back on and talk about the progress that's being made in this.
I would look forward to the opportunity. The company again is Filament Health. That's FLHLF on the OTC QB, FLHLF, and FH on the NEO in Canada.
Great. Thanks, Ben. A great story.
You're very welcome.
Wow. I'll tell you, Charles, you really hit a home run today too. Really.
Well, you can't talk about Lockheed Martin or Boeing all the
time. Well, I think we're starting to when they're rattling the sabers, when it.
Yeah.
Oh, brother. Hey, well, Charles, we'll be talking with you next week. Okay?
Yeah, and next week, Jacob will be back from RAADR.
Okay.
And we'll see how their launch went, and we may have another psychedelic story.
Hey, sounds good. Well, Ben, thank you so much for being with us. Jacob as well, and Charles, obviously glad you are back.
Thanks. Thanks again, Ben.
Charles Moskowitz.
Thank you so much.
Here on WPSL Global, WPSL.com, worldwide on the TuneIn.